Surgeons, what was your oh crap moment? Doing a C-section for this poor mom who'd been in labor for hours. Baby wouldn't come out of the hole we'd made, and suddenly, whoosh, baby zooms out. Thankfully, the midwife was ready with the towel and caught the baby to wrap her up. Mom and dad seemed to think this was normal practice and didn't notice, but me and my colleague just stared at each other with a look of absolute horror. Never happened before or since. Story 2. I was doing a corneal transplant when I had the oh crap moment. During surgery, I replaced it with a new donor cornea. During that moment when the host cornea was off, but before I could get the new one on, there's literally nothing. Anyway, the patient takes that moment to start vomiting. The reason we tell everyone to skip food and drink is so they don't aspirate in case they throw up. This patient lied about eating breakfast and started throwing up everything. The eye is still open sky at this time. Everything inside of the eye can now become outside of the eye. And she's bucking and vomiting. Those not in the know will say, this is not good. Those really in the know will say, oh crap. Anyway, I had to end this surgery. I used 10-0 nylon sutures, which are thinner than an eyelash. It turned out okay, but not great. Don't lie about eating breakfast before surgery, folks. Story 3. I was the patient. I had a liver transplant and was having an ERCP done to place a new bile duct stent. Well, apparently my anatomy is different than normal, and my lungs go more down my sides. So he accidentally caused a nick, which caused a hemothorax. So when I woke up, I couldn't breathe. They did an x-ray and had to do a chest tube. Eventually, I was so exhausted I asked to be vented, so he vented me. Apparently, he cried he felt so bad about it all, but it wasn't him being malicious or negligent. It was simply an accident. Story 4. Not a surgeon, though I thought I'd share this. Husband went in for a routine colonoscopy, and as they were prepping him, anesthetist asks him if he's a ginger. My husband tells him yeah. When he was a kid growing up, he had fire engine red hair, though it's faded to a more strawberry blonde now. The anesthetist laughs and says, okay, I gotcha. We'll give you the redhead dosage, and winks. Well, my husband thinks it's funny until he wakes up at the tail end of the procedure, pun intended, and doctors are just chatting it up and what have you. Turns out it's not a joke, and redheads have some type of natural block to anesthesia. Dude had given him max allowable dosage, and he still woke up. Happened a couple years later. They gave him ketamine and some other crap to knock him out to get wisdom teeth out when he told dentist about the colonoscopy thing. He still woke up at the end of that one too. Story 5, surgeon here. I've dealt with loads of morbid stuff, but one thing that made me stop and go, oh crap, was a conversation with a patient who had a perforated colon from diverticular disease, which is a common wear and tear of the colon. He was one of the youngest patients I had seen with this condition, and certainly the youngest with a perforation so bad as to require an operation. When I was counseling him on the operation, which involves removing the perforated part of the colon and giving him a colostomy, he told me his biggest concern was how he was going to have sex with his same partner. It made me really think about the implications of the surgery we do. The operation is the easy part. Story 6. When I was a new RN working the ICU in a large teaching hospital, I came into work one morning to a patient that was admitted that night. Intubated, breathing tube in, sedated, Foley catheter, tube and pee-pee hole, and all. Long story short, he was extubated, breathing tube out, that same shift, and was completely alert and oriented. He was an end-stage renal patient, meaning his kidneys didn't work and he needed dialysis, and was only in his late 30s. Said he never made urine anymore, and didn't need the Foley catheter, so he wanted it out because it was hurting. Now the catheter bag had been empty my whole shift, which is normal, seeing as how he didn't make urine anymore. And this hospital had a nurse-driven Foley removal policy, meaning while we needed a doctor's order to insert one, we could remove one at our discretion, unless a doctor specifically put in orders not to. This patient had no such doctor order, so I went to remove the catheter. They are held in the bladder by a balloon on the end that is inflated with 10 milliliters of saline. I de-inflated the balloon, removing 10 milliliters of saline, and pulled it out. As soon as the catheter left his junk, blood started pouring out in a heavy stream. It turns out the nurse who placed it on admission hadn't advanced it far enough, since there was no urine production to indicate correct placement, and had inflated the balloon while still ensued, causing trauma. I had to hold this man's junk shut to put pressure on it, while my coworker paged the resident who came and looked at me with pity as he told me to just keep holding this 30-something-year-old man's junk in my hands to staunch the blood flow until urology could get there to assess. It just kept gushing blood every time I eased up to check. For over an hour total, I held this man's junk and tried to make polite conversation until the urologist arrived. Story 7. I'm not a surgeon, but when I was in med school, there was an oh crap moment for everyone, including the surgeons, anesthetists, nurses, and students. They were prepping a patient for surgery and put him under, and the nurse said, okay, he's out. before they were about to start surgery. The patient just had enough strength to move his head from side to side and said, "No, I'm not out yet." Everyone laughed it off, but if the patient didn't do that, it could have ended badly. Story 8. Not a surgeon, but was working in obstetric theater in UK mid-heatwave last year. This is important as maternity wards are kept quite warm as newborn babies aren't good at regulating their temperatures. Combine this with a heat wave and the fact that in Britain, we're not exactly used to high temperatures and we have the perfect storm. Mid-emergency cesarean, the scrub nurse assisting the op starts feeling faint. This is unusual as this scrub nurse worked in these theaters full-time, so this was her bread and butter, so I can only conclude it was the heat. She has to step out, so the show takes her place assisting the obso registrar with the section. This show looked extremely junior, as in first section ever, and they were trying to assist with the instruments inside when they fainted. I had to jump in and grab the back of their theater gown to stop them face-planting to uterus, and then sort of gently tug backwards to let them fall into me when someone else has taken over assisting. This show was not exactly small. Thank God the baby was already out. Story 9. My grandfather told a story about a clamp coming off an artery while he was pulling a kidney in rural Wyoming in the early 50s. The abdominal cavity was quickly filling with blood and the nurse fainted. He was able to push down with his elbow on the descending aorta and got the clamp back on. Patient lived, but I think he chose his surgical assistants a little more carefully after that. Story 10. Not a surgeon, but I was having surgery on my breast to remove what they suspected was cancer. It was benign. But either way, I woke up during the surgery and I looked up and saw 4 people with scrub caps on, staring down at me. I looked at my boob in pure horror, and that is all I remember because they knocked me back out. Still makes me want to vomit thinking about it. Story 11. Heard an oh crap moment as a patient on the operating table. A couple of years ago, I was in labor for 28 hours, pushing for 6, when my child started showing signs of distress. He had slightly elevated heart rate, and I had the makings of a fever. My midwife at the hospital told me the doctor was coming in to check to see if a vacuum assist could help. She checks me and immediately stands up with blood on her hand and says, "We're going to the OR now." At that time, I started feeling that zoomed out tunnel vision. I know for me is shocked. I had anxiety but figured she knew what was best. She did. We got in the OR 8 minutes later. I heard the surgeon say, "Oh crap, look at this." They say my son was actually trying to come through my uterus. Those moments where he was stunned and not crying were an eternity. He cried, and he was born a completely healthy baby. After I woke up and was back in my room, the doctor came in and told me what happened. When I went back for my post-C-section follow-up, my midwife let me know as a practice that's been around 35 years with over 30 midwives and doctors, they had never once encountered that. And it was such a big deal for them. A few days after my birth, they all got together to discuss my case. I was so incredibly fortunate, I chose to labor in hospital, that the doctor just knew from my vitals and babies that something was off. They just didn't know until they got me open. I can't even tell you how grateful I am for Dr. S. You saved my life and my son's life and our family with Be Grateful Forever. Story 12. 8 years after finishing medical school and deferring student loans through residency and fellowship and realizing that I was closer to 40 than 30 with over $200,000 of debt. Story 13. Not me, but my uncle. He's a respirologist and was sitting in on lung surgery to remove a tumor. Turns out the tumor was a root ball. Some type of seed had gotten into the patient's lungs and started to grow. Story 14. I had an ingrown toenail. It was supposed to be a quick fix. I had my mom with me. They let an apprentice do the surgery and he goes, "Oh crap." The doctor in charge just laughed and said, "No risk, no fun." Turns out they ducked up my toe and I had to have 4 more surgeries to correct it. I cried. Story 15. When I was younger, I had a rather complex external fixator cage applied to my leg. It had 3 rings, 2 large 360-degree rings around my leg, one in the upper middle of the shin, one in the lower, which had humongous rods to keep the cage fixed to my leg, and a third one, which was a horseshoe-type ring around my ankle, which threaded all sorts of pins through my ankle, each pin set in a certain way. The point of this external fixator was to relocate and fix the positioning of my ankle, so it wouldn't be so ducked, basically. I have had a birth defect called Talipes, clubfoot, equines. A lot of bone got removed before the fixator was put on, so this way it could all grow. It was a 9-hour surgery, and my doctor, who I won't name, was pretty chuffed with himself after seeing it all installed on my leg. This was until he looked closer. The pins I spoke about before, with the numbers on them, almost like those sizing things on cheap coat hangers, were all colored and numbered, set for my dad to do every morning and night. He was looking at the pins and the numbers. He looked glance away and looked back with a stressed face on. After a few seconds and a slight hand-on-head gesture, he whispered, "Crap." In his mind, he had organized the pins in an incorrect way. He was stressed beyond his mind for a few minutes. He was worried he ducked everything up, luckily. He hadn't. He just needed to move 1 or 2 numbers 1 year later, 8 months after the frame was taken off, which was in for 6 months. I ended up having my leg amputated. The surgery didn't work how we wanted it to, or at least how I wanted it to, which we were sort of expecting. The goal was to get me walking. The amputation got me running. Bear in mind, the amputation was my call. Best decision I ever made. Story 16. Not a surgeon, but when I was in nursing school, I was observing a tonsillectomy when the power went out. Everything switched over to the backup generators except for the suction, which is incredibly important for any surgery, but particularly in the throat, aspiration risk. They ended up having to connect a giant syringe to a length of suction tubing to suction manually, while someone went to the other side of the building to find portable suction. Luckily, ours was the only theater that had started operating that morning. Story 17. Former medical student here rotating through general surgery was mainly an enjoyable time. I remember one young patient, 22 years old, was revisiting the ER, where he'd been seen 6 weeks prior for sustaining some abrasions and bruises after falling hard off a skateboard. He was all SCD up everywhere, but had healed up okay. But now he's in the ER again, feeling awful sick, vomiting and with a fever. As the third-year med student, I was dispatched to the bedside and hung up the CT films on the light box, to much finger-pointing and grunting among the surgeons. I had no idea how to read a CT at the time. I wasn't even really sure what part of the body had been scanned. So when the surgical resident barked, "Prep him for surgery," I was nonplussed, decided to disguise my ignorance and just go for it, as was the approved way for students at this busy public hospital way back when. We got him gassed and prepped, and I scrubbed in. Surgeon said open, and I raised the 15 blade. He'd been prepped for a midline laparotomy, but I guess I exposed my ignorance when I spoke up to confirm same. This was decades before timeouts, before wrong sight became a never event, because everyone laughed. "You remember how to perform the Kocher maneuver?" the attending barked. "Yes, sir." "Well, do it." I slid my gloved hand, but met unexpected resistance. I peered up, seeing in my confusion that everyone was edging away from the table. "What's the trouble, young man? Get your hand up there and complete the maneuver. Push harder." A spongy sort of barrier gave way, and with a sickening stench, immediately recognizable as the locker room aroma of Staphylococcus aureus, a gushing cascade of 2 liters of gray-brown, bloody pus roared out of the incision, soaking my gown, scrub pants, and shoes before splattering on the OR floor and walls. The splenic abscess, doubtless caused by the transient bacteremia from his skateboard accident, had been lysed, ruptured, evacuated, and mostly cured. The attending finished up with the splenectomy, and after some abdominal lavage, the patient was good as new. I had to throw out my shoes. Story 18. Not a surgeon, but my mom had to have a kidney removed due to her waiting for almost 2 years to go to the doctor about her pain in her back. The doctors found out it was a large kidney stone, and that her kidney was infected and had lots of gross pus shutting it down. After draining the fluids through tubes over the course of a month and a half, she was finally ready for surgery. Cue last Wednesday, the day of the surgery. She was ready to finally be done with it. They removed the stent and put the tubes no problem. Next was the kidney. Here comes the oh crap moment. As they get ready to remove the kidney, there was complication. The kidney's infection had spread to a portion of her lung and a major artery, making them fragile as toilet paper. At that point, it was a race to save her life and stabilize her. I don't remember much about how they fixed her up there, but they had to fly her to a different hospital. Anyways, the heart doctor saw the grave situation and said she's got a 1% chance for her to make it. But he did such an excellent job that my mom is still alive and getting stronger each day. The moral of this story is, if you have insurance and are experiencing pain, go to a doctor as soon as you realize it. You may save your life and also save some doctors from an oh crap moment like this. Story 19, not a surgeon. Was just an LVN at the time, working in a small town LTAC. What a med-surg unit used to be before insurance got weird. People stayed for between a week and 6 months or more to heal from whatever they had. Lots of vents and trachs. I get a call from the local ICU that one of my patients was returning after being shipped out to the main hospital for a GI bleed repair. The RN on the phone is giving me report and offhandedly reports he was throwing up a little this morning, but I've been checking his PEG feeding tube and there are no residuals, so I don't know where it's coming from. Must be reflux. So an hour or so, EMS rolls the guy in and he has vomited all over himself during the ambulance ride. We set up suction to get it out of his trach, and I notice this guy had been with us a while before his surgery, that his stomach is super distended, like Pregoman distended, alcoholic cirrhosis distended. He was a big man, but not that big. I go to check residuals because I never trust reports, especially with evidence To the contrary, right in front of my eyes. I attach a 60mm syringe to the peg and pull back and get a syringe full of air. Now, if you check residuals and stomach is actually empty, you may get a little air before the tube collapses on itself and stops pulling back. No, full syringe of air. Empty the syringe and pull back again. Another full syringe of air. After this, I look at the EMTs and the attending, who is now in the room, and remove the end of the syringe. There is an audible hissing noise for a good 5 seconds as air escapes before black digested blood starts rapidly filling the tube. MD tells to hook the peg to suction, which over the course of 5 minutes fills with 500 milliliters of blackish, reddish, green contents and more air, indicating that there is not only still a bleed, but possibly a perforation as well. The attending called the intensivist on his cell phone from the room. The intensivist was like, "No way my nurse wouldn't be that stupid." So the doctor sent him a picture of the canister. The intensivist sheepishly calls back and reaccepts the patient back to the ICU, where he underwent a revision and was back to us a week later feeling much better. I still have nightmares of that syringe filling with blood. Story 20. When I was in pharmacy school, I was doing my internal medicine rotation in my final year. My preceptor and I were doing med reviews in the ICU when one of the pulmonary docs was basically like, "Hey, you want to see something cool?" They were trying to extract a foreign object from a guy's lung in one of the rooms. So we go in and watch for a bit. About 6 people in the room. Tube down the guy's throat, little grippers at the end, 2 doctors watching a monitor, and trying to control the grabbers and get it like a claw game. I watched for a bit, then after a while I lost interest and went back out to what I was doing. A few minutes later I hear, "Got it, cheers" from the room. Oh, it's a tooth. Dude aspirated his own molar. Doctor walks out with his trophy in a jar, and it's a completely intact tooth root and all. Story 21. During my 3rd year of medical school, I was stitching up the wound after breast cancer surgery, and the anesthesiology nurse woke the patient too early as I was making my last stitch, and I felt the patient moving her arm and trying to sit up. Patient was still covered in surgery draping and cables and still intubated. Luckily, most people do not remember much from the first moments after waking up, but I got quite nervous from the patient starting to move. Story 22. Just an RN here. I was working in the ER and had a patient brought in by her husband. Apparently, the woman had a fall a week prior and injured her face but refused medical care. Her husband finally forced her to come in. As soon as I see the wound on her face from across the room, I think, that does not look like any wound I've seen. I approached her and realized maggots there. A really simple and quick fix, but I can't imagine her living condition. Story 23. I was a 4th-year resident and I was on call that day around 5 p.m. I went to do rounds, and as I got to the first room, I came in to find the first-year resident on top of the very recently neck-operated patient. That morning, he had a tumor removed from his parapharyngeal space. The resident was kneeling next to the guy's head with his hands and clothes completely covered in blood. I was instantly petrified. I have never ever repaired someone's carotid artery. I am completely unqualified to help this guy. Someone please help us. I was the senior resident, so I was the only one on call at the time. And besides, none could get there in time to help this guy. He was bleeding out, so it was up to me alone to help him. So I took the guy to the OR as fast as we could, and I start surgery all of the time, praying and telling myself, it's okay, I can do this. I can do this. I was crapping my pants while everyone was looking at me to fix him. I see the freaking facial artery loose, so I clamped it, put a knot around it, and that was it. We bandaged and transfused the poor guy, and I went to collapse on a stool. Story 24. Wisdom teeth removal. All 4 impacted. Gotta break out the heavy hardware. I'm knocked out. Don't even know the dentist entered the room. I wake up but not able to move. Just eyes open awake, but my limbs won't react to my brain. I can feel the dentist hammering a chisel into my tooth to break it for extraction. My jaw is just coming undone on every hit. My eyes are wide open, jaw even wider with some evil metal contraption. I'm staring at the assistant, begging her to see me, and after about a dozen hammers to my jaw, she glances over and drops the suction, jumps up and shrieks. The dentist stops to look at her, then looks at me, and I see him say, "Oh crap." Next thing I know, I'm waking up post-surgery. Crap that nightmares are made of. So this was a military dentist. Yes, they put me under, and no insurance involved. Not sure what they used for anesthesia. Yes, I could feel pain from the impact, but not nerve pains in the actual tooth. Story 25. Not a surgeon, but I have caused 2 surgeons to experience those moments. The first was when I went in for a sinus surgery septoplasty. They gave me the anesthesia, wheeled me into the operating room, transferred me to the table, and started to prep me. I hadn't had surgery since I was 5, so I had no idea what was normal. But then they started to D me, and the surgeon walked in fully scrubbed. So I decided to speak up and ask when I was supposed to fall asleep. Cue the panic from the nurses and techs. The doctor just laughed and called the anesthesiologist into the room to give me more medics. I freaked them all out again when I woke up projectile vomiting while they were still cleaning me up before they had even transferred me off of the operating table. No, I hadn't eaten. It was all bile. The second time was last year when I had my port installed. I was supposed to be out thanks to twilight anesthesia, but it just didn't work on me. They wheeled me into the OR, and we were all just waiting for it to start to kick in. But I wasn't even getting drowsy, so they gave me more. Still nothing. At this point, we had been waiting for some time for me to at least get drowsy, but nothing was happening. So the surgeon had the nurse anesthetist call the anesthesiologist to get permission to give me even more medics, including a stronger one that they don't normally use for twilight with these procedures. The anesthesiologist didn't really understand the fact that I wasn't asleep yet, because she said no, because they would have to get the patient's consent. So they put her on speaker in the operating room so that I could tell her that I had consented. She was quite taken aback, but gave permission to use the medics. I got all dosed up and we waited, but absolutely nothing happened. Finally, I just told the surgeon to get started. They use local anesthetic in addition to the twilight with these procedures at the local hospitals, but I metabolize local so quickly that it lasts for a few minutes at most. Yes, dental work is about as fun as you would imagine. So they got me prepped, numbed me up, and cut into me. I felt everything. The surgeon and I chatted during the entire procedure to help keep my mind off the pain and discomfort. He said it was the weirdest, most terrifying port placement he has ever done, and he has done several thousand of them, never with a patient awake, and providing active feedback though. Thankfully, these incidents taught me a lot about how I process and react to different forms of anesthesia. So now when I have surgeries or small procedures, I'd taken a paper that lists the different anesthesia medications that I've had weird or bad experiences with so that my surgeons are prepared. Story 26, gastroenterologist here, was removing a large polyp during a colonoscopy. I put the snare around the polyp, kind of like a cowboy throwing a lasso. It took an unusually long time to severe the base of the polyp, until all of a sudden, blood started squirting from where the polyp was removed. The screen quickly turned red with blood. I couldn't see crap. The patient's blood pressure started to drop. The patient, who was a dark-skinned Middle Eastern man, turned pale white on the stretcher in front of me. That's when I felt like I was gonna faint and empty my own bowels. The only thing I could think was, oh crap, people asking what happened. I gave myself a moment to breathe and control my emotions. Once I cleared my head, I let my instincts kick in. We gave him a bolus of fluids to bring up his blood pressure and put him a Trendelenburg position, head down, feet up, to maintain blood flow of his brain, lungs, and heart, and try to reduce blood flow to his gut where the bleeding was. I turned on the water jet and diluted the blood with as much water as I could, hoping to establish some kind of visualization and eventually clip or cauterize the blood vessel. As it turned out, the patient's blood pressure dropped just enough to stop the bleeding automatically. That gave me a short window to aspirate the mix of blood, bile, and water, giving me just enough visualization to identify the vessel and clip it. The man lost 1/3 of his blood volume in less than 60 seconds. He was admitted, transfused, and discharged the next day. The polyp turned out to be cancerous. However, the margins were clear, so we saved him from a hemicolectomy. These days, if I anticipate a similar situation, I just refer them for surgery. I'm not interested in being a hero. Story 27. I bet there was an oh crap moment when my anesthesiologist put my epidural in the wrong nerve. And I knew at BC, I had had one before. They didn't listen to me, and I almost died, BC. They kept pumping me full of the medicine, and ended up having to give me a general on top of it after they realized their mistake. Story 28. Never had one in 20 years. I have some how is this going to play out from time to time. You do extensive training and preemptive thinking to be prepared for stuff. Sorry, that isn't exciting. I have pulled some nasty stuff out of people who thought it was a good idea to shove stuff in themselves. Story 29. Not mine, but my father's. He had a 21-year-old patient that needed to have a penectomy. He had cancer of the junk. There were two oh crap moments for this. The first is a common thing. He wasn't fully asleep. The second, however, is funny and humiliating. They were about to start the surgery. Suddenly, one of the nurses that was there suddenly threw up and left. A test later, and boom, she got knocked up. Halfway through the surgery, the other nurse leaves for a call about her father. My dad's just standing there, a half-gone junk in his hand. He calls for help and is standing there, a guy's junk in his hand, for 30 minutes. Story 30. When I was a surgery intern, I was pulled from doing scut work to help out in a crap show of a case. One of our professor emeritus in surgery was doing a simple liver biopsy on a patient and nicked her hepatic artery. The biopsy was for a recurrent tumor, and the patient has been on chemoradiation. Pretty much all hands were on board. The chief residents were scrubbed in. The seniors were literally squeezing blood bags into the patient's veins. And us interns were runners, going back and forth from or to blood bank to transport blood and plasma. We ended up transfusing over 40 units, 12 liters of blood, so the patient lost over 2 times her total blood volume during that surgery. A vascular surgeon eventually swooped in and did a rather slick patchwork that fixed the problem. Even better, the patient was like a daughter to the surgeon. He literally saved this patient's life several times already, and they got really close over the years. She even named one of their kid after him. The poor guy broke down a few times during the surgery and was convinced that he had just hit his daughter. The chief residence had to take over a few times when he was mentally not there. That was his last surgery. He retired the next day. Hell of a way to end a surgical career. Story 31. Not a surgeon, but there was a young girl who had her heart removed at Duke University Hospital for a transplant, only for the doctors to realize afterwards that the heart they were about to put in was the wrong blood type. I'd image that scenario qualifies as an "oh crap" moment. Story 32. I was assisting on an emergent crick and emergency airway cut into the neck when all other attempts at getting an airway have failed. Surgeon hit an artery. Blood painted the walls for a hot second until he was able to get in there and clamp something. Zero. Recommend. Story 33. Not a surgeon, but the patient, and undergoing gallbladder removal. Almost unheard of for someone my age to have gallstones bad enough to need a removal. But anyway, I was extremely underweight and sickly. The anesthetists gave me an adult dose of anesthesia and knocked me out for about 8 hours, when it took the surgeon about 40 minutes to complete my surgery, so there was a lot of panic that day because no one could wake me up. And I was pissed off when I woke up because I couldn't feel my left arm with the IV in, and I really needed to pee, tried to get up to go toilet, and ended up on the floor instead. They also got me a piss pot that I refused to use. Story 34. Not a doctor, but my grandfather was scheduled to have double knee replacement surgery when he was in his 70s. They go through a bunch of health screenings to make sure your body can take the stress of the surgery. And during one of these screenings, the cardio doc found an aneurysm in his aorta, running basically the length of his torso. The doctors were shocked he was still alive with that in his chest. He ended up having to have stent surgery in his aorta first, and then a few months later was cleared for his knee replacement. Story 35. Not a surgery, but I did get surgery on the injury. I dislocated my shoulder, but it was an inferior dislocation, so the normal pull it back into place is the wrong way to pop it back in. It dislocated once before, like 6 months prior. The nurse kept insisting that she knew how to put it back in place, so she proceeded to pull on it for 15 minutes, all while I'm screaming in pain. I started vomiting and almost fell off the gurney, profusely vomiting and demanded a doctor. The doctor popped it in, no problem, taught me how to do it myself, shot me with who knows how much morphine, and has me sign papers that I don't realize release them of the liability of ducking up my arm even more. My shoulder was so loose I dislocated it reaching for my wallet in my back pocket. I had reconstructive surgery about 3 years after and now have a little less. Then 90% mobility in my arm and cramps and pain if I sleep on it wrong or reach too far or move it too quickly. Story 36. Orthopedic surgeon here. Mostly do joint replacements. Several things. Started operating independent in my first job about 2 years ago. Was obviously nervous when I first started. Took me about 3 months to get comfortable being able to do this every day without stressing over every detail. One case, I just got this epiphany at the end that I just did a hip replacement on this patient in 45 minutes through a 5-inch incision. I've got a pretty cool job most days. Not an "oh crap" moment, but I felt pretty lucky. Doing open cardiac compression on a patient who was coding and had an ER thoracotomy as an intern while wheeling the patient on gurney up to, or having a unit of blood run down my leg while doing CPR on a patient in the trauma bay. Connector between the blood bag and the patient's IV came loose and no one noticed until it had basically emptied all down my leg. Mostly just felt cold, but I had to walk through the main lobby of the hospital covered in blood past patients and families to get to my call room. Threw away my underwear and socks, did the rest of the 24-hour shift commando. Having the CEO of the hospital get fired because he scrubbed into a case, he's an admin, not a medical person, and made the incision on a cardiac case. This happened this week. Doing a total knee replacement in fellowship and letting the tourniquet down at the end. Knee fills up with blood in about 2 seconds. Long story short, my mentor had injured the popliteal artery, and holy crap, that's a lot of blood. Story 37. Not a surgeon, but when I was a nursing student, I was on theater prac. We had a guy in who needed humerus and elbow repair. I was pretty useless in everything but emotional support, as I wasn't qualified. So I was chatting to him before he went under. He admitted to having an unhealthy med habit. I informed the surgeon, who shrugged it off. Apparently, I should have told the anesthetist, because this dude woke up mid-surgery and was trying to reach for his open arm that the surgeon was working on. Super "oh crap" moment, as we scrambled to contain this guy's arm and stop it from touching anything sterile. Story 38. I was the patient, It was a kidney biopsy. I was drugged up and out of it, but still awake, laying on my stomach as my kidney doctor worked behind me. He warned me, "You're going to hear a click, and it will feel like Mike Tyson punched you in the back." Okay, I hear, click, feel the punch, then hear, "Oh, crap, get so-and-so on the phone now." A nurse came up near my face to calm me and maybe keep an eye on me. I don't really remember everything. Apparently, he had nicked a blood vessel, and I was bleeding internally at an alarming rate. I got to spend the night in the hospital and pissed what seemed like pure blood for about 24 hours. Never try to fit your kidney biopsy in on a Friday before the doctor leaves for vacation. Story 39. My dad's not on Reddit, but he's told some stories. One of my dad's colleagues was doing a hip replacement. Way back in the day, we're talking 60s, 70s here. Hip replacements aren't fun. They have to pretty much butterfly. So he's got to that stage, tapping the stem down the femur. When it jams halfway, won't go down any further, won't come out again. Can't close up the patient and then come back to it. Story 40. We operated on the carotids of a patient, like gaping holes in his neck, when the patient woke up. Easy Fix was shouting at the anesthesiologist, which wasn't there. I had to hold the head with my elbow so he wouldn't move too much and hurt himself. Story 41. I work in cardiovascular and I can think of a couple. On my 8 years career, I've had 3 patients start moving their arms in the middle open heart surgery. One of them even tried to sit up. The surgeon was literally pushing the patient's shoulders down and yelling to anesthesia to give the patient something. Another time, a simple pericardial window. For different reasons, sometimes patients can have extra fluid buildup in the pericardial sac that surrounds the heart. The surgeon made a small hole and stuck the sucker in to suction the fluid out and make room for the heart. He stuck the sucker in too far and stuck it through the ventricle. Blood shot out of the small hole just below the sternum. He had to quick open up the patient under the ribs. We had to call another surgeon in to help quick crash onto the heart-lung machine. Story 42. An oh crap moment happened to me when I was a toddler, but I barely remember it. They were operating on my lungs and forgot to give me enough general anesthetic, so I woke up 5 hours too early in the middle of the procedure. Luckily, they only were doing minor slits into my stomach. They noticed the problem straight away and gassed me back asleep. They couldn't inject me like they previously did because I was in the middle of the procedure. Story 43. I am a surgical first assist here. A patient once came by the ambulance as she, too obese to move, complaining from bad taste in her mouth. Me and the surgery resident at the air went to check here and she started giving us info. She then told us she sometimes feels pain in her belly, so we uncovered it here to see what is going on. And oh, her whole abdomen was all gangrenous. The surgeon immediately took here onto the OR where we started debridement. The smell was horrible. The med student fainted there. We kept removing dead tissue. So we had IV solution and sterile packaging, so we opened few like butterfly wings and stitched it to what is left from the muscle and sheath. The surgery was completed and the patient was sent to the ICU. A day later, I was rounding that patient and she was doing fine, and then started coughing uncontrollably that she tore the stitches. It was horrifying that I fainted. When they woke me up, I knew that she passed away, unfortunately. I was a student back then, but it still haunts me to this very day. Story 44. Not a surgeon, but a biomedical scientist. My office mate had his MD and was working on his PhD. He did an appendectomy and cut into this person's abdomen, only to find no appendix, and started freaking out. The support nurses in the room started snickering at him because they knew right away what it was. Occasionally, they see someone with a rare genetic disorder, in which all their left-right asymmetries are reversed. The appendix was on the other side. Doesn't seem so funny to me because the patient would have come in saying where the pain was. Story 45. Graphic injury description. Nurse here. My oh crap moment happened when we admitted a patient to a medical unit. Initially, the smell was horrendous. After removing his clothes, what I saw was worse than the smell. He had a very, very advanced bed sore that was on his butt. It had gone so far that X-ray showed his sacrum, and the vertebrae above it were completely gone, as were his posterior iliac crests. That was all laced together with greenish-black mucus. I couldn't believe the guy was alive. I can still smell it 36 years later. I have nightmares about that butthole. And as I was the newbie on that unit, the charge nurse assigned him to me for the next 10 days. On day 11, he died. I still can't understand how his wife could sleep with him and not see or smell that. Story 46. Patient presented for a swelling in the abdomen, which had a fluid wave, but the fluid could not be aspirated in any position. Patient was taken to surgery for exploratory, and upon opening the abdomen, I was greeted with thousands of clear, fluid-filled cystic structures roughly the size of marbles attached to every organ in the abdomen. At that moment, I realized that this patient had metastatic ovarian adenocarcinoma, and it was physically impossible to resect all of the metastatic lesion, since that would be total evisceration of the abdomen. Patient was euthanized on the table at the request of her mother. At this point, I will point out that the patient was a chicken. Story 47. I was patient, and I'm pretty sure it was an oh crap moment for my OBGYN. I had had 2 epidurals, both of which wore off. My OB used forceps to try. I don't think she knew my epidural was as ineffective as it was. Otherwise, I don't think she would have shoved the forceps in like she did. I obviously felt the forceps and started thrashing in pain. The doc got scared and tried to take them out, but they got stuck. Had to wait for the next contraction to push them out. Then blood went everywhere. She was on the phone with her lawyer while wheeling me in for my emergency C-section. I assume that means she had an oh crap moment. Story 48. It's not a doctor, but I have a family member that was one. During his residency, a gentleman came in with an infection he developed after having his dumb SCD during a dental cleaning. The infection had gotten into his sinus cavity, and my relative told his attending that the gentleman was going to die. They had an infectious disease specialist from Harvard at the hospital at that time, and he called my relative an idiot. The attending corrected the guy from Harvard, saying that no, the guy was likely going to die. He had seen 10 such infections previously, and each time the person died. Apparently, there's a part of your face some physicians call the triangle of death. The gums of your top teeth form the base, with the sinus cavities forming the arms. Anyway, over the next 2 days, the infection spread to the guy's left eye. Mr. Harvard said that they should take the eye, and hopefully that would be enough to save him. My relative said it's not going to make much of a difference, and the guy should start working out his final affairs. Obviously not wanting to give up, the gentleman consented to having his eye removed. It didn't make a difference, and within 3 days of having his eye removed, the gentleman was dead. Story 49. I'm just an RN. I do home health. I was admitting a patient yesterday, and his referral basically said, "This is a VIP. Surgeon wants us to be very accommodating." Now, this is weird. This isn't the kind of thing I get on a referral. So I get there and meet the guy who is incredibly nice. He just had a knee replacement, but he's otherwise healthy and functioning pretty well on his own. But midway through the admission, he gets a look on his face and asks, "Is it normal to hear things during your surgery? During a knee replacement?" "No, sir, it isn't." He follows with, "When I woke up the first time, I could hear banging and some machinery." The doctor stopped and looked at me. He asked if I was awake, and I told him I was. The doctor asked me how I was doing and if I could count backwards for him. The next time they woke me up, I was in recovery. Oh, so yeah, this patient's anesthesia was too light during an ortho surgery. Those are rough surgeries. And he was awake enough to answer questions and count. This is why he's the VIP. It's honestly not the surgeon's fault. But damn, that's a bad day at work. Story 50. Not a surgeon, but had some dental work done. I had 2 impacted teeth. One was being taken out by some elaborate gear, and the surgeon who had filled me full of medics thought, well, the tooth is sticking out, I can just pull it. He tried one tug, and I almost fell forward out of the chair. The second pull, he had a nurse hold my shoulders. The third, he put his foot on the chair, used both hands while the nurse held me from behind around the waist, and he yanked. And like in cartoons, when a bullet bounces around the room and nobody can see it, yeah, that was my impacted tooth. I was numb and didn't feel a thing except a warm sensation all over my chin. I learned that I was a bleeder. Story 51. Saw a med student suck up a skin graft with the suction device. The skin graft is a very thin piece of tissue that was being carefully laid onto the wound, where it was then to be sewed on, carefully, like a patch. The med student was using the suction to clean up the wound and accidentally sucked up the carefully prepared graft. Poof, gone instantaneously. Story 52. My boyfriend once heard his surgeon say, "Oh crap," during surgery. BF needed surgery on part of his rear end. Woke up halfway through and angrily said, "Somebody is touching my ass." He heard someone say, "Oh crap, he's awake." And then he was out again. Story 53. In the mid-80s, my dad's coworker had liposuction on the backs of her thighs. For the procedure, she was laid on her stomach and was placed under general anesthesia, or at least she was supposed to be. She woke up and could feel the doc doing the liposuction, but was paralyzed from the anesthesia, so she couldn't move or cry out. It was incredibly painful and incredibly traumatic. I wish I could remember what happened with her after, but my brain was scarred enough at her having been a prisoner in her own body during surgery. Story 54. There's been a few for something I was doing personally. A kid fell on a broken coffee mug and had a tiny cut just below the sternum. I was just to clean it and close it up with some stitches, but when I was exploring it, I found their damage inside was much more extensive. The oh crap I've seen was stuff during transplants. There are these things called life ports that are used for kidneys. They allow fluid to circulate during transport from the donor to the recipient. The kidney was okay though. Another surgeon just couldn't get it to open and was getting frustrated and asked for a mallet. He was going to bash it to try to open it. Story 55. Standard appendectomy. I was a resident at the time. Surgery was ready. The The surgeon began then. We realized the patient didn't even have an appendix. It turned out he had appendicitis a few months prior, so he went to the ER and they said he had appendicitis, and the treatment was an appendectomy. So, this time when he had similar pain, he went to my hospital, said he had appendicitis because he thought that's what stomach pain was. And in some strange breakdown in communications, someone approved the surgery. Never found out why his stomach hurt, story 56. Not a surgeon, but the patient. In 91, I had a dislocated shoulder. I had to have rotator cuff surgery. My orthopedic doc was giving me a shot of cortisone in my bursa. He kept missing it. It was painful, especially when I could feel the needle escape my scapula. At that moment, the doc literally said, "Oh crap." The nurse who was holding me steady in front of me got huge eyes. I just laughed and said, Now, doc, language." I was weirdly calm. Story 57. I'm an anesthesiologist. In my first year of residency, we had a young patient of 25 years posted for a relatively harmless liver abscess aspiration. I was in my third month of residency and was responsible for loading the medics required to keep him anesthetized. After the patient was under, we had to turn him onto his side so that the surgeon could have better access. One of the technicians was asked to press a button on the remote control, which controlled the OR table, so that the head and neck was on the same level as that of the abdomen. When he started to press the button on the remote control, the button got stuck permanently pressed down. I vividly remember this case, as it was my first "oh crap" moment. Immediately, all my attendings ran into the room and started to give him CPR and revived him after 3 cycles. We suspected vasovagal syncope, and my head of anesthesiology later referred the patient to a hospital with better facilities. Story 58. Not a surgeon, but EMT at large-scale events. Got an emergency call about someone coughing up a lid of blood after taking a nasty fall. Talking pints here. It was one of our interns doing the call, so you might suspect where this is going, but I didn't at the time, so that is when I had my "oh crap" moment, because that is a lot of blood, so I was ready to dial the ambulance. I arrived at the patient, looked at the ground where she had puked a lot, really a lot, bright red. My first question was, "What did you drink?" She listed about every red drink on the list, plus a few Cokes when she started to feel unwell. Seemed it was no blood, just a weekly pay's worth of red booze. Story 59. Not a surgeon, but a patient. I had this growing lump right behind my ear, which was super painful to the point where it became difficult to sleep. Obviously freaked out, my mom took me to the doctor and they were just as stumped, saying it might be a huge pimple or something similar. She called the on-call surgeon just in case. He took one look and said, "Something is definitely in there." After some local anesthesia and a lot of digging, it turns out one of my earrings, tiny butterfly studs, had burrowed into my ear during my sleep. My mom suddenly recalled my missing earring, thinking it had fallen off in school or something. Kind of freaky. Surgeons of Reddit. What was your biggest "oh crap" moment during surgery? Part 2, Story 1. I'm a med student. A surgeon once told me that his "oh crap" moment was when a patient of his that had a carotid artery blew out due to a tumor growing into that artery. Problem was that the patient was in a small hospital in his hometown with no surgeon available who specialized in this type of cases. Furthermore, there was no way of getting the patient in time to our center as it was rush hour on a sunny Friday afternoon. It was also not possible to transport the patient to our center by helicopter, as the hospital in his hometown did not have a helipad. Luckily, our hospital did have a helipad with a helicopter available, so they took the surgeon by helicopter to the smaller hospital. Since there was no helipad at the hospital, the pilot was forced to land the chopper in a park. And mind you, it was a sunny Friday afternoon, so it was full of people. As soon as the chopper landed, a crowd formed around the helicopter. The surgeon told me that the moment he exited the chopper, they all started clapping and cheering for him, making him feel like star. He ran to the hospital and into the operating room and immediately started operating on the patient. He was done around 2 a.m., but the patient made it. Story 2. My dad caused an "oh crap" moment for a surgeon when he heard them say, "Okay, he's out," before they were about to start surgery. He just had enough strength to move his head from side to side as in, "No, I'm not out yet." Story 3. My father is a physician, and although he's not a surgeon, he did some surgery while in med school. He told me a story about a patient he had once who had necrotizing fasciitis. The patient had gotten a cut during gardening and never cleaned the wound. My dad told us that he had to peel back layers just to get at it. First, he peeled off the bandages that the patient self-applied. Then there was a layer of holy book pages that he also had to peel off. Following that, there was another layer of bandages and then a final layer of more holy book pages. Beneath that, there was the wound itself, which was covered in maggots. He said that once they removed the maggots, they were able to begin the surgery to remove the infected areas. but it was because of the maggots that they didn't have to amputate the limb. After this operation, my dad decided to not pursue surgery and focus on becoming a specialist. Story 4. I'm currently in med school, and this happened a few years ago when I was attending surgery classes. One patient was up for a laparotomy for removal, an investigation of an abdominal mass, probably cancer. Imaging tests were really not specific or of much help, as this was some atypical disease presentation. Even specialists couldn't figure it out. To everyone's surprise, the patient's cancer was really a forgotten gauze from some previous surgery. The actual moment of realization went as the surgeon just stopped and said, "Gauze," to which the nurse promptly gave him one and he went, "No, there was a gauze inside of him." Story 5. I'm a medical student going into surgery. I get my MD in a year. I haven't been at this long enough to have the wealth of stories that an actual surgeon would have, but I have a few that stand out for my time in the OR so far. Most recently, I was assisting on a lung surgery called a decortication. This is done when a lung is trapped in place either by a complex infection, inflammatory tissue, etc., and needs to be freed up to work properly. This lady was middle-aged, but has a history of several bouts of pneumonia and a 30-pack year smoking history. Going into the procedure, we weren't sure exactly what we'd find, but we're hoping it was just scar tissue from the untreated pneumonias. As soon as we got inside her chest with the scope, it was obvious that this was not the result of infection. Her entire lung was essentially caked in cancer tissue, adhering it to her chest wall and her diaphragm. We had discussed this possibility with her and had her consent to do whatever was necessary once the surgery began. At that point, all the minimally invasive scopes and instruments went away, and my attending guided me through an open thoracotomy. Once inside, my attending obviously did the work and I just assisted, but we removed her entire lung and some lymph nodes for testing. Her chemo started the next day and she's fighting now. Story 6. Not a surgeon, but a student. In the early days of this teaching hospital's high school volunteer program, they essentially used us as free tech labor. But when things were otherwise slow, they'd toss me some scrubs and send me to watch cases in the operating room with the med students. Since my mom worked there, they were sort of testing this out with me. On the very first case I saw, the surgeon lost the needle from the end of the suture in the abdominal cavity and couldn't find it. They ended up wheeling in an x-ray machine to locate it. During the next surgery I watched, the surgeon heard student and assumed I was a resident. He launched into an X-rated joke he claimed he found on the back page of Penthouse. When he finally hit the punchline, no one laughed. Finally, someone asked if he remembered our visiting student. I clarified that I was a freshman, not a resident. He paused and whispered, "College?" I replied, "High school." When he realized, he started screaming at the anesthesiologist for setting him up and threw a tray of scalpels and forceps at him. It took a few minutes to get the correct count for the number of tools and their locations after that, and the anesthesiologist switched rooms with a buddy. After this, he was extremely professional and formal, but still didn't bother to ask my name. He did a great job on the patient. The oh crap moment came when my mom met him in the call room a few hours later and said, "I heard you had some drama in your room today." Happy to have someone to vent to, he launched into the story and embellished a bit about how bad it was to justify throwing scalpels. I think he called me jailbait. That's when she said, "You know that's my daughter?" You could hear him cursing the anesthesiologist all the way down in recovery. Story 7. I'm not a surgeon, but I was a patient. This one time, the anesthesiologist came to my room before surgery and injected me with something. I don't remember clearly. But the moment they made the first incision, I woke up and screamed so loudly that the guard of Hades would die. It turns out I was still conscious but fell asleep while counting from 10 to 1. The anesthesia was not proper, and I got the surgery 3 days later with the proper anesthesia. The scream is an expression. Story 8. I am a nurse and the doctor was an anesthetist, but still relevant. Patient had her surgery, I can't remember what. All went well. She was awake and recovered. We needed to give her a medication through her IV line, so, as is standard practice, we flushed the line with 10 mL of saline. The patient immediately stopped breathing. We had no idea why. We called a code, and the anesthetist came running. He actually said, "Oh crap," when he realized what had happened. During the surgery, the anesthetist had given the patient rocuronium through that IV line, and he hadn't cleared the line afterwards. So when we flushed the line, the patient got a dose of rocuronium that had been sitting in the line. Rocuronium is a muscle relaxant, used to inhibit the respiratory muscles to allow for intubation and ventilation during general anesthetic. In layman's terms, it paralyzes the breathing muscles, so you can't take a breath no matter how hard you try. But it does not put you to sleep. This patient was wide awake but totally unable to breathe. Luckily, the anesthetist worked out quickly what had happened, and it's easily reversed. The patient was physically fine, but understandably traumatized. Story 9. Obligatory patient as well. I had a friend growing up whose mom and dad were both specialists in eye, ear, nose, throat, and mom was a surgeon to boot. This couple knew me when I was in diapers. End of second year of college, my voice starts going all wonky. One day I'll do an unintentional Valley Girl impression. The next it's like I'm trying to sound like Batman, but it always hurts to talk, and eventually my voice just goes out completely. I can full on yell and not be talking loud enough to hear. I figure, hey, let's see Mr. and Mrs. Dar, as they'll get me an ASAP. So Mr. DR sticks this probe up my nose, feels weird, man, and into my throat and looks around. Spitballs, I have 12 or 11, depending on how you count them, growths in my vocal cords. Since they're obviously ducking things up, and we don't know if they're malignant cancer, he calls his wife right then, and I'm on the surgery schedule for a few days later. Impressively fast for someone with student insurance. Day of surgery comes. Mrs. Doctor actually comes out to dish with my mom for a bit before doing the whole rigmarole about what she's doing and the various what-ifs. Basically, though, she's going to remove and biopsy the crap out of these things. This is war, and they're going down the hall to the lab. I get wheeled in, doctor is chatting, introduces me to her nurse, some other lady in the room, probably another nurse, and the new anesthesiologist. Tells me about her daughter's college trips, whatever. Anesthesiologist gets his stuff set up, get ready to count back from 10, whatever. I guess that for throat surgery, the tube goes down to near your lung to pump in the med's O2, and I start getting loopy before he even shoves it down there. One small issue, the growths. He snagged a couple and accidentally rips them open, trying to force the tube in. So now I'm not out, and Mr. New Guy just made the first incision by accident because he rushed and took a wrong turn with the tube. I should have been out first, thank you. They pushed some calming med, and I don't have great memory after the first mistake, but apparently my doctor was pissed. She stopped the bleeding quickly and made an angry call, letting the head of the hospital's anesthesiology department know he's coming down there because he hires duck-ups. He came down in about 15 minutes. I'm completely out of it now. Mr. New Guy is sent to wait outside, and she does the procedure. I wake up later and she's telling my mom about the size of the growths. She has one in a little jar, just to show us how impressive it is, even though it's like kidney bean sized. She's already dished the whole story to my mom and explained why the whole thing took so long. She has apparently canceled the surgery after mine, since it was going to be with Mr. New Guy again, so she had time to check on me. Results: not cancer. No idea how long Mr. New Guy lasted at the hospital, but possibly not too long. Story 10. Some years ago, my wife went in for surgery, and we asked to have her tubes tied at the same time. After the surgery, the doctor came out to talk with me. He told me the surgery went great and that she's just coming out of the anesthesia now. I asked about the tubes and his eyes got really wide. He said, "I'll be back in a few minutes," and practically ran back to the OR. They had to put her back under and reopen the sutures. I'm glad I asked about that, or we might have had a much bigger surprise than that. Story 11, or nurse here. Had a patient with an ascending aortic dissection who was delayed getting into the OR for a few stupid reasons that had nothing to do with us. Fortunately, patient was still stable. Finally got the patient on the table and began to apply the skin prep solution. Suddenly, we start hearing the anesthesia machine start making the unmistakable sounds of vital signs plummeting. The patient turns blue and codes, shorthand for cardiac respiratory arrest. After 30 minutes or so of resuscitation and trying to get to the tear, the patient didn't make it. Story 12. Husband broke his back at work. Because it was a workers' comp issue, the insurance made him go through everything but surgery first. 6 grueling months later, he was approved for surgery. He was in severe pain for months leading up to this. So we were really looking forward to this procedure. Day of surgery, they wheel him in, and I go sit in the waiting area with about strangers waiting for their loved one. I knew it would be about 5 hours. Approximately 40 minutes later, a nurse and the actual surgeon peek their head in the waiting room. He looks directly at me and says, we have a problem. Can you step out here, please? My knees buckled. I felt the air leave the room as all the others gasped. I somehow found my feet and felt like I floated out to the hallway. He says, "Hubby is fine, but right before I made my incision, I double-checked the cage, equipment they put in to stabilize the spine, and it's the wrong size. We have to wake him up and reschedule." Surgery ended up happening 2 days later, but my poor guy suffered a lot. Looking back, I'm really glad that surgeon double-checked before cutting into him. The hospital was extremely accommodating to us afterwards, to a fault. They were very nervous about a lawsuit. We just forgave and moved on. Mistakes happen. Story 13. Not a surgeon, but when I was in training for a different medical career, I was in the cardiac cath lab, where you get stents put in, etc. I was shocked to see 2 competing sales reps in the operating room with us, encouraging the docs to use this product. Then another, try mine, no try mine. It is normal to see one sales rep in the cath lab, but competitors made my stomach turn. These products were being pulled out of stock cabinets, not handed by the reps, and scans so they were being charged to the patient. They were wasting supplies, literally 2 of every supply from competing companies, to make the sales reps happy. It blew my ducking mind. In the melee, the doc forgot to numb the dude's foot before threading a catheter in through it. Dude was on midazolam, so he wouldn't remember anything, but he was awake and complaining heavily of the pain. I asked the nurse if any medics were given to him, and she checked, and sure enough, they forgot to numb him. I called them out on it, and they decided not to numb him because he won't remember any of this. It was a total crap show. Complete, total crap show. I reported the duck out of everyone. Second story. In an GYN operating theater, a woman is having a hysterectomy in a teaching hospital. She's under anesthesia, and the lead surgeon gestures to someone to come in with a group of med students. The professor inserts his hand inside, telling them how he's examining her. Then, 4 medical students proceed to do the same thing to this unconscious woman. I asked the lead surgeon if she had consented to this, and it turns out that no. They do not tell women this is happening. They convince themselves she has consented because it says in her consent form that a medical student may aid in her care. This had nothing to do with her care. I went to the attending and he said, "This is a part of training." I was beside myself because this legally qualifies as abuse because it is the unconsecrated insertion of a body part. They never tell her it happened either. So if she wakes up sore, well, figure that out, lady. It turns out this is only illegal in 3 states. I now research medical abuse. I don't think doctors are bad, quite the contrary. After 15 years of research and time in the hospital, I think the system lacks ethics. Story 14. Patient here. Radical nephrectomy. Removal of a honeydew melon-sized cancerous tumor on my kidney. It had stuck to stomach and bowel, so lost a bit of those, then got sepsis. Had a car accident, went straight through the windscreen and seatbelt locked, so I ended up in the seat with face mangled. Every so often a piece of glass comes out, but there was a piece in one of the big scars. So I went to A&E to ask for a scalpel, as I was happy to remove it, and they panicked, and I was rushed into surgery as if it had moved. It could have entered bloodstream and heart, and he still didn't know if he got it. I'm a walking disaster. Story 15. Not a surgeon, and not during surgery, but I was a patient after surgery and caused a total of 4 oh crap moments. I had gone in for surgery on my elbow after breaking it. They put in a few screws and a large plate, and I was seeming to recover well. It had gotten to the point where the stitches had just been removed. I would have only a large plaster over, and had to change it every morning. When I was changing it, I had noticed that the wound had split open, only a small part with just a little bit of the metal visible, and some pain. I called in and they told me that it is normal for some pain, and it too looked open, so I thought nothing of it and just waited until the checkup a week later. When I got there, they took the aster off to check everything was healing, and, well, it wasn't. The small split had grown to the size of a 2p coin, and I had to be sent back into surgery to get everything checked and stitched back up. And again, after the stitches were out, it happened again. So for the 3rd time, I was sent back to surgery. This time they removed the plate because it was stretching my skin out, causing it to open up, and used a wire type thing instead. This time my skin didn't split exactly, but the skin somehow healed under some of the wire. So yet again, I had to go back into surgery. By this point, the bone had healed enough to be okay with just the screws, so they removed the wire and sticked my now royalty ducked up looking elbow, and it's been okay since. The scar's pretty gross though. Story 16. My mother had a cerebral hemorrhage 19 years ago. I was away on holiday at the time. Insurance paid out and got me flights back quickly as it was touch and go whether she survives the attack or the upcoming surgery. When I returned, the brain surgeon come to tell all my immediate family that he first operated on the wrong side, but he also said that he found an aneurysm ready to go, so he clipped that side, then proceeded to do the problem side. Remarkably, she survived. She is still going strong 19 years later, aged 75, but does suffer with memory loss and trouble writing. Story 17. Patient had bitten through the trach tube, and I didn't know the gas anesthetic was leaking out. I was trying to concentrate on monitoring the anesthesia and grab instruments, and assist was feeling sleepy and sick. And the patient was super light, but still out. And if the gas cranked as high as it would go. I finally smelled the damn gas and held my finger over the hole in the tube until surgery was finished. Story 18. Not a surgeon's oh crap, but it happened during surgery. More of the anesthesiologist oh crap, though the surgeon was probably pretty worried too. I went in for a scheduled C-section at 37 weeks with my first and only kid, and at the time, my first surgery ever, unless you count wisdom teeth. They decided to do the C-section because my kid had an in utero growth spurt, and at 37 weeks was 11 lobs. If I went to 40, they were concerned my kid would be 15 lobs plus. Check in and everything was great. They got me prepped and wheeled me into the surgery bay. Then the anesthesiologist came in to give me the spinal block, so they could actually cut me open. They injected the stuff into my spine while I was sitting up, then laid me down in the bed. The moment I was horizontal, my blood pressure tanked to 60/40, and I started vomiting uncontrollably. Thank God I hadn't eaten anything, so it was just bile. My OBGYN had to start the surgery immediately, while my anesthesiologist tried to do something. I don't know, I was pretty out of it. I vaguely remember they whisked my kid off to the NICU. My mom going with her and my other support person stayed with me. I honestly don't remember most of what happened because I kept losing consciousness from my blood pressure being so low. My mom told me after the fact that they had brought a crash cart into my recovery room because the DRS were super worried my heart was going to stop. After about 4 hours, my blood pressure finally stabilized, and I was okay. I ended up being in the hospital for 4 or 5 days recovering from the C-section. Goes to show that sometimes even a routine surgery can end up being damn. Story 19. Obligatory. Not a surgeon, but as a student assisting in the operating room. 65 IO guy with kidney problems, possibly cancerous, needed to have a chunk of his kidney removed. Okay, no big deal. We give him meds, knock him out, then prepare to operate. We removed his gown, and everyone in the room froze. One of the surgeons actually said, "Holy duck balls," which is relatively accurate. Apparently our guy had some muscular disease that caused a massive abdominal hernia. Then there was the time we had to amputate a lady's leg that was riddled with gangrene. I was with the nurses cleaning the patient for surgery when the surgeon came in to check on us. One of the nurses pressed too hard on a dressing, and it popped a blister full of pus across 2 people. Everyone screamed and dry heaved at the smell, ducking horrendous story 20. Not a surgeon, but a patient. I had a bad case of mono. I couldn't eat for about a week because my tonsils were so swollen. There was physically no room to swallow even chewed up food, so I needed to have my tonsils removed. They take me to the room where they're gonna do it, and I'm already a bit scared. Never been in the hospital before, never mind having surgery. I'm 23 at the time, so also no parental support because it's the middle of the day, and they can't get off work because their 23-yo son has to have his tonsils removed. So I'm alone. So they prepare for the procedure and get me knocked out. Next thing I remember is waking up to the craziest coughing fit I have ever experienced or will again. I didn't even have brain power to try and control what was going on. My entire body was just intensely focused on coughing for what felt like 5 minutes. It was more like 1 minute. Convulsing, tightening, and almost cramping. I remember it stopping and then passing out. Not sure if from exhaustion or anesthesia. Turns out a duckload of blood had flowed/fallen, leaked into my lungs during the procedure. I was basically fine though, just ended up having to recover for 4 days from a lung infection. Thinking back to that 1 minute, or however long it actually was, is still pretty scary. I was not in control of my body at all, just a lifeless passenger in a coughing body. I imagine this is what dying is like without the coughing. You just experience things happening to your body but have no control over them. Story 21. I'm not the surgeon or the patient. This is my friend's story. My friend's father got lung cancer. He was a smoker, and it had spread to his brain. They were going to treat the brain issues by gamma knife surgery. Now, my friend had been rather unimpressed with most of the hospital staff so far. Nobody seemed to be able to answer any questions, and there'd been a few dumb mistakes, such as not mentioning an upcoming test he'd be taking required him to fast first, serving him meals as normal beforehand, then throwing a fit when he truthfully answered that, why yes, he had eaten food recently, why not? But my friend felt some relief when first talking to the neurosurgeon. He was friendly, answered all their questions in detail, and actually seemed to know what he was talking about. Cue to prep right before surgery. Her father's got this huge metal deal on his head, screws into his skull and everything. The surgeon is talking to him and the family when suddenly he stops, looks at her father, and gets an odd look on his face. He leans closer to the patient, then fetches a stethoscope. He listens to the patient's breathing, and an "oh crap" look of horror crosses his face. He calls, "Get this man to the ER, now." Turns out the father had recently had a lung biopsy performed by a student. When doing so, she'd punctured his lung, and somehow none of the nurses or other attending doctors had noticed. The neurosurgeon was apparently quite livid. Luckily, they were able to fix the lung and perform the brain surgery later. Story 22. Patient at a dentist, and not nearly as terrifying as most of these stories went in for a cavity fill. And my dentist often has students that do cleaning and assisting for their practicum. It's not uncommon for me to get locked jaw just from something like yawning. Well, they had just finished, and my dentist left the room and let the student clean me up and remove the gear from my mouth. Lo and behold, my jaw was locked. I wasn't freaked out as it happens all the time to me, sometimes lasting up to 5 minutes. She sat there for probably 10 minutes trying to massage my seized muscles to get them to release, all the while looking freaked out and constantly asking if I was okay. She couldn't get it to be released, so she called the dentist back and he tried for another 5 minutes. At that point, Even he seemed a bit disturbed. It escalated to them discussing different methods of getting my jaw to relax. Like maybe I would have to go to the hospital, maybe they could numb it with lidocaine and get it to relax. And then all of a sudden it just popped shut with no problem. Went to the doctor and it turns out I have worn down joints, very large jaw muscles, and a loose tendon that allows my jaw to sit improperly when I open my mouth wide enough. Story 23. My brother broke his arm on his 6th birthday OFC. Had to get pins put in. He wakes up from the surgery and tells the nurses that his fingers feel kinda numb. Turns out that the pins had been placed wrong, and if he hadn't said anything, he probably would have serious damage to that hand. Story 24. I'm a dental student, but during a surgical extraction case, my partner was wiggling the wrong tooth for a good 5 minutes before I looked and realized what was going on. She was supposed to do one just in front of it, so I just tapped the tooth with the suction, and her eyes got real ducking wide before she moved the elevator forward. PT was okay though. Story 25. I was in surgery once for a large abdominal hernia repair. We cut out around the belly button on a stalk to replace later, but forgot to mark on the side skin we took out what vertical level it should be at when put back. The surgeons all eyeballed it and tried to guess based on feeling where her hips and ribs were under the D. They placed it perfectly in the end, but could have been a disaster to have your belly button end up too high or low. Story 26. Probably my surgeon when he left for a vacation while my surgical site had come undone on my intestinal tract and spilling bile into my system. Yeah, good thing he left. The cosmetic surgeon he left in charge airlifted me to a trauma center where I was advised to sue the pants off him. Too bad lawyers are pussies and wouldn't take the case. Story 27. I caused my oral surgeon to have an oh crap moment. I had to get my wisdom teeth removed when I was 18 and I have anxiety, so I was put under. They put the IV drip in my arm, which caused me to freak out a bit, but nothing major. And I was out. I woke up with a blue microfiber towel on my hand where the pulse monitor was. I asked why it was there to the best of my ability and found out that in the middle of the surgery, the pulse monitor started beeping. I have very poor circulation and the IV made my hand so cold the pulse monitor thought I was dead. The oral surgeon, of course, started to get worried before realizing what was going on. Story 28. My mother's a doctor and during her training she was assisting as an anesthetist alongside a senior surgeon and other junior doctors. The senior surgeon had a very short temper, which was known amongst most of the faculty. Towards the end of the surgery, one of the junior doctors ended up making a minor mistake. I forget what he did. And the senior doctor stabbed him with a scalpel and had to keep on working on the surgery. Afterwards, my mom had to patch up the poor guy. And for reference, this was a while ago, back in a time where a senior doctor like this could end your career before it even began if you spoke up. So he and others went unregulated for years. Story 29. Not a doctor, but my dad was getting a cardiac catheterization done, and the doc forgot to give him a local anesthetic. The nurses were very confused when he turned stark white and almost passed out until they realized he wasn't given anything to numb the pain. Funny thing about it is, my dad was too embarrassed to say something about the excruciating pain he was feeling. He didn't want to be seen as a big baby. Smach. Story 30. Most anesthesia doesn't work on me. I had an endoscopy and woke up in the middle and fought the entire staff to pull the tube out. For my C-section, they gave me a spinal tap and an epidural to make sure, but I was able to move and feel most of it. I woke up partly to try to pull a trach tube out during my appendectomy. I told all this to my doctor before a jaw surgery, so they didn't even bother knocking me out, kept me awake while removing part of my lower jaw. Luckily, I have an extremely high pain tolerance. Story 31. When I was fresh with the knife many years ago, I forgot to give my patient a liquid to cleanse out the inside. I realized into the stomach wall and was met with my patient's undigested dinner from the previous night. Story 32. Not a surgeon. Patient here. I was on the operation table. I had several swellings on my throat, neck maybe, whatever, I hope you get it. The two biggest swellings, one was on my Adam's apple and other on the right side of my neck. It was a small surgery just to extract the contents of the swelling to check if it's cancer or not. So I'm on the operation table. I can't stop thinking about cancer and other serious stuff. The surgeon pops up and says, "Which one should I remove?" I was like, "What? Which one should I remove? The one on the right or the other one?" I literally said, "You're the surgeon, you should know." Then I thought what a dumb crap surgeon he is and told him to go for the right one so that he doesn't mess with my Adam's apple because the swelling was right on it. I was afraid he'll mess it up. Story 33. A little different than the other stories. But my old roommate had some sort of surgery and the anesthesiologist turned out to be the father of this girl I was casually hooking up with. My friend said the last thing he remembered before going to sleep was the doctor saying, "So you know my daughter?" To this, he only remembered trying his best not to shout out, "My roommate is duck your daughter." Story 34. I'm not a surgeon, but my mom's friend had a surgery 3 months ago for her gallstones, 3 stones was seen during diagnosis. After the surgery, my mom's friend asked the doctor why only 2 was pulled out, and the doctor's face was like, "Oh crap," after that question. Yes, the surgeon ducking forgot the other one inside, and now she's given some medicines, hoping that she would be able to dump it out with her poop. Story 35. I'm not surgeon, but something that happened to me. I had a child via C-section. It ended up being an emergency after a long labor, so things inside were kind of a mess. Anyway, baby comes out healthy, and hubby and are tired but relieved. And I'm lying there looking at the baby my hubby is holding as they're sewing me back up. Well, all of a sudden, bells are ringing and they rush my hubby and baby out of the room. People start pouring in, including a surgeon who was wearing huge rubber boots. I guess obstetrics is a messy business. Anyway, very thankful for modern medicine and people who donate blood. I do now too, because it's all good under the hood. As the person it was happening to, it was definitely an oh crap moment. Story 36. When I was a med student, on my surgery rotation, we had a patient code just as we started the first incision. It was a laparoscopic surgery, and we were making the opening for the first trocar, when all of a sudden, the anesthesiologist says, "Start compression." The attending said, "What?" And the anesthesiologist confirmed that, yep, patient had suddenly died. Sterility went out the window, all organized and effective. Hell broke loose. The patient's heart started up again, and they recovered fully. I never heard why it happened. It was the strangest thing I've seen in the OR, and I've seen some weird stuff. Story 37, doing a foot surgery. Trying to screw the bone, just me and the attending. We're screwing the screw as hard as we can, and it's not biting. We try a smaller screw. We try a longer screw. Still isn't biting. Then, crunch. A few bone chips and K-wires later, and we had it fixed. But go damn, I was sweating for that small period of time. Story 38, obligatory patient. The orthopedist thought my shoulder was dislocated. They put me under to relocate it. I woke up, screaming. The surgeon turned pale. "I thought you were out." "I'm not ducking out you." I used up every cuss word I knew in 5 languages, and then I was out. And they had to put in a crap load of titanium plates and screws and bolts and various bits and pieces. I said some really terrible things to the guy. I actually looked him up a few weeks later and apologized. Story 39. My mom has fibromyalgia. Even sedated, if the surgeon touches her foot, it will jump. Mom nearly had a botched foot surgery because of this and scared the crap out her surgeon. Ironically, the foot that was nearly botched is now her better foot. She had rods put in both feet to correct damage that had just been left for years. Story 40. Not a surgeon, but it caused a sort of oh crap moment. Back in 2011, I had an unscheduled surprise amputation. They tried to save my middle finger, but the veins couldn't regrow. A couple weeks later, I went in for outpatient surgery to have it removed. I thought it would be funny to put a Swiss Army knife in my brace with a note that read, "Please attach." Apparently, my surgery was delayed by almost a half hour because the surgeon and the rest of the crew couldn't stop laughing. Story 41. My mom's left arm seemed to give her surgical team an oh crap moment, with one hell of a spiral fracture. When 5 surgeons all ask, "You're not left-handed, are you?" It doesn't instill a lot of confidence. To be fair, they did a bloody good job after 5 hours in theater, and she gets to amaze her grandkids by proclaiming herself Cyborg Granny, and she hopes she'll excite some archaeologists somewhere down the line. There are a lot of pins in her arm now. Story 42. My surgeon may have said, "Oh crap," when they were investigating a mass that was suspected to be a cancer due to calcium, like lesions throughout it. It was my left forearm. When he made the incision a big amount, congealed blood fell out. I had the surgery repeated. It turned out to be an AVM, which is still there, but now involved in the bone instead of the soft tissues. Muscle and tendon was removed the second time to ensure no regrowth. Story 43. Good old, I'm not a surgeon, but us surgeons are pretty chill. We have seen a lot over the years and nothing really makes us go, oh crap anymore. Surgery in itself can be taught to anyone. Our old chief always used to say, you can teach it to a monkey. The important thing is, you need to be able to make a decision. So, oh crap might happen if an artery blows, but it's really not an oh crap moment if you know what to do next. Surgeons of Reddit, what has been your biggest oh crap moment? Part 3, Story 1. I doubt you'll get too many real stories. Mine is extremely rare, as I was the patient but awake for the surgery. I was supposed to have a bump on my back removed. Nothing huge, just a lump of some kind. For insurance reasons, they did it as an ambulatory in the OR of a hospital instead of the surgeon's actual office. So I'm wide awake, face down in the OR. I had picked him as my surgeon because his main practice was plastic surgery. At the time, I lifted weights a lot and spent a lot of time working my back. I wanted as small a scar as possible. I was in vain. He begins with the first incision, then goes for a second, larger, then goes deeper, I guess. and realizes the bump is just the extruding tip of a cyst. He wasn't used to operating on alert patients. As soon as he realizes that, he just says, "Oh, duck." That was the beginning of a 4H year of surgery for which I was awake. What they cut out of me was the size of an adult fist. I couldn't lift weights for years. All that precious work shot down the drain. What in a hole I was. Story 2. I woke up during the last part of my gallbladder removal. I felt this pressure as my surgeon, had him for a prior operation, funny guy, was trying to close one of the wounds. I lifted my head, we locked eyes, and he had this startled, "Oh, duck, look." Then he snapped back to normal, said, "Patience up," and the anesthetist was on that crap. Woke up an hour later in recovery. Story 3. This one's for my dad. We were putting up a central line for a drip with an 18 Gino needle, 0.2 meter, relatively big compared to most needles, in the patient's external jugular. And all of a sudden, the needle went right into the jugular. We all started panicking because usually with a drip, the needle is meant to come out and only the plastic remains, but now we had lost the needle. Inside. This guy's jugular. Before we could even fish it out, it was gone. I looked at the fellow surgeons and nurses, and before we could do anything, we rushed him right into theater. After a few minutes, we fished the needle out near his subclavian vein, closer towards the shoulder, and we breathed a sigh of relief. Story 4. Craziest. Probably a medical student passing out face first into the wound, then falling backwards. He starts bleeding from the head and isn't moving. Just total silence for a few seconds. We didn't know whether to laugh or yell at him, or what. Luckily, I didn't have to have that talk with the family. Favorite. When I was a student, my chief resident was sleeping with one of my friends, who was also a student. We were both operating with the chief of surgery when someone pages the chief during surgery. The nurse looked at it and said it wasn't important. Chief gets annoyed and asks her, I just call it back. She replies it was a text page. Would he like her to read it? He says yes. It was my friend telling him she wanted to meet him in a call room after he was done. Paraphrasing here. Another awkward silence. Residents sleeping with students is a no-no, and having them page you in surgery is one too. But the chief of surgery was having an affair with the nurse. We all knew it, so after a rapid-fire exchange of significant glances around the table, we all shut the hell up and finished the case and never spoke of it again. Story 5. My specialty is the lower extremity, so there aren't too many things I can screw up that make you say, oh crap, and all hell breaks loose. But the one that immediately comes to mind was when I was chief resident and was doing an ankle fracture with a junior resident. Nothing crazy, but definitely needed to be opened and repaired. So the resident was dissecting down to the site of the fracture on the inside of the ankle and was getting close towards the back part of the ankle where all the tendons, veins, and arteries are. So she points out an area that was part of the joint capsule that needed to be opened up to visualize the fracture and asked if it was okay to proceed. It was close to the artery, but it looked okay from where I was standing, so I said, go for it. As she goes to make the cut, she accidentally bumps the other leg with her arm and it falls off the table. The circulating nurse promptly picked the leg up and put it back on the table. Then I look back at the surgical site and start seeing a massive amount of blood rushing out of the wound. Immediately I thought, damn, she hit the artery. As I'm getting ready to start looking for the source of the bleeding, my nerves calm down and I realize the blood is dark and not real bright, indicating it wasn't arterial blood flow. As it turned out, the other leg falling down hit the tourniquet and caused it to deflate, which let the floodgates open up. Once the tourniquet was reattached, everything was all right. Story 6. My first C-section was quite the shocker, but after that, not a lot faced me anymore. This event occurred during one of my internships as a high schooler to see if medicine would be my field. Why, I'm not sure, but they let me attend a C-section. They placed me at the feet of the woman that was numb chest down. I gave her a little nod, and the operation started. Well, no one had thought to tell me that once the belly is cut, the liquids go out too. This is a logical thing, but I was seated at least 3 meters from the feet of said woman, and the fluids gushing from her abdomen came all the way to my feet. Here's me, standing in a woman's pregnancy fluids. Oh, duck. I must have looked very shocked because the other surgeons had a laugh about my reaction. Ever since, I've not been shocked once. Story 7. Way back in the day, pre-op was done with alcohol-based cleaners. Naked, sedated guy with a light sheen of cleaning fluid on him, plus static electric spark. It was fully engulfed in flames. Everyone just stood there for a second till someone grabbed a sheet and put out the flames. Surgery went well, no complications, slight suntan. Balboa Navy Medical Center, San Diego, old surgeon. Story 8. The medical stuff really becomes a blur. Complications, bad outcomes, crazy patients, I don't know. But after a few years, even the bad stuff just becomes part of the routine. But there was one moment that still sticks with me from training. I was called into a meeting with the program director, which is never a good thing, and I wasn't entirely sure why. He makes some small talk, then start asking about one of the junior residents who had been on my service. Definitely one of the weaker residents, but hardworking and likable. I start talking about her performance and her relationship with the other residents, her strengths and weaknesses, etc. After a minute, I came to the horrible realization he wasn't just asking about her. He was gathering ammunition to fire her, and I was part of the firing squad. I jammed on the brakes and tried to talk her up, talking about her work ethic and how well she got along with the nurses and the team. But we both knew it was a done deal before I sat down. I don't know why it bothered me so much compared to kids who burned to death and the like. But that sudden realization while I was sitting there, that someone I kind of liked personally, who had spent most of their adult life struggling in undergrad, medical school, and the lab, who had what I suspect was six-figure debt, was about to get their career destroyed, just stunned me. I don't know if she was going to be an unsafe doctor. I think the fact we liked her allowed her to slide further than she should have, in retrospect. But of all the terrible things that happen in residency, that's the one I think about most often. Story 9. Mine isn't as gruesome as some these, but I figure I can share. I have several herniated discs, pinched nerves, spinal spondylosis, etc., etc. Went in for a major epidural. Most people get one too, but I was getting 6. Basically, they put you under, fit a needle in between your discs, and give you a shot. Well, it might have been due to the fact that I was taking some heavy dosages of substances already, but I woke up on the table. It was kind of hazy, but I was definitely aware. I could feel a slightly burning, fuzzy feeling in my back. It felt like butterflies when your leg goes asleep and there's something scraping near on or on my bones feeling. I could see a screen with a live x-ray looking thing. I found out the surgeon watches the screen to guide the needle. Just as I could feel like I may be able to raise my head, I came to the realization one of the nurses kept repeating, "He's awake." Not too panicky, but definitely like, oh crap. I wanted to tell her to relax, but by then someone walked up to one of the IVs and I was back to sleep. All in all, it was a win. I threw a Karen fit about how good the fruit juice was, so they gave me the whole container, and I tried to fight the nurses trying to dress me because my girlfriend was waiting outside on me. She thought it was cute, so she obliged and brought me to Wendy's per my request. I then ordered over $20 of food, got home, and ate none of it. Good times. Story 10. Had a friend with a swollen area on his lower back where it got to the point where he could barely sit. So he goes to his family doctor, the doc, says, "Yay, that's a pilonidal cyst. We should probably go ahead and take care of that." He told my friend to take off his shirt and lay flat on his stomach. So he's laying there and waiting, and the doctor says, "You're going to feel a poke," and is at this point expecting a local. Well, first it turns out the poke was actually a scalpel, not a local. He said it basically felt like someone took a fire-hot poker and drove it into his back. He then hears the doctor exclaim, "Oh boy, we have a pumper," just as he feels warm blood and pus is now pouring all over his back. The nurse's face, which was the only thing he could see, went from a warm smile to what he termed as pure and unadulterated fear, as the doctor is screaming for her to get gauze and towels. The doctor climbed up and laid on his back to apply pressure for about 10 minutes until the bleeding stopped. So yeah, I'm hoping I never get one of those. Story 11. Patient here, but I have a good, oh crap, surgery story. I was told to get my impacted wisdom teeth removed. I went to a surgeon who informed me that they were pretty much formed and I would be put on general anesthetic, totally asleep, and the teeth would be broken up to be removed. Day of surgery, I go in. Because of how ducked up you get on anesthetic, my mother was scheduled to pick me up after a couple of hours. She arrived and was informed that I was still in surgery. After nearly another 2 hours of waiting, she felt like something wasn't right and called my father. He came in and was likewise informed I was still in surgery. At some point, they finally said they wanted to see me and threatened to call the cops. It was then revealed that my jaw had been broken. Instead of breaking up my wisdom teeth, the surgeon had tried to take them out in one piece, and on the very first tooth, he snapped my mandible. It popped up into the muscles in the back part of my cheek, coming up against 2 nerves, trigeminal and facial. He wired it shut in a panic, without consent or an x-ray. Turns out, the reason you take an x-ray is because you need to make sure the bone is set. My bone was not set. Over the course of the next 2 weeks, the bone didn't heal because it wasn't set correctly, and instead, it slowly sawed through my trigeminal nerve, destroying sensation in the lower right half of my face. I looked like a stroke victim because I had very little control over it. It's since gotten better and moves more or less with the rest of my face, but I don't have as much control there as I should, and sometimes I bite it and do a lot of damage since I can't feel it. This was probably the most pain I've ever been in my entire life. I took liquid Vicodin, remember jaw wired shut, every 2 hours, could barely sleep, and needed help with tasks like walking upstairs and going to the bathroom because of the pain and the medics. It was hell on earth. We eventually found a doctor to fix it. He had to reset the bone. This was about a 6-hour surgery and a 2-night hospital stay. The bone was so badly out of whack that it needed a plate and 7 screws installed to stabilize it. My jaw was wired another 10 weeks while that healed, and of course, the nerve damage is permanent. You can definitely tell which side was busted from both the surgery scar and the lopsided smile. The original doctor who broke it refused to admit responsibility or pay any of the damages. Presumably, he was told by malpractice lawyers never to admit to ducking up. So I sued for that. In the deposition, he said he broke up the tooth, which of course he hadn't. I had the tooth to prove he was lying, after which we settled for the amount of damage. But about 75% of it ended up going to things like lawyer fees, so I still came out behind on all that. But I have a wicked scar on my neck from the surgery, and my other 3 wisdom teeth, 2 of which cut through. Yay. So I got that going for me, which is nice. Story 12. Worked in an OR for a couple years as a biomedical engineer. Sprinted to the room when equipment that wasn't working right, or more often, the surgeon or anesthesiologist didn't know how to use the equipment. This happens so much. With about 70 ORs, this was a fun day. 1. A surgical table was malfunctioning going into full trend. Elberg, table tilts to a serious angle, was tilting on its own and patient was sliding off the table. The whole surgical team was holding onto the patient as I run in. The fix was, I slammed the controller against the floor a few times. Patient was okay, but blood everywhere. 2. A resident was putting in a trochar and misplaced it, sliced open the aorta. Hours of surgery to repair. She was going in for a simple procedure. 3. Surgical robot froze in a case. Had to reboot, but the arm was grasping a main blood vessel. So we didn't want to reboot for fear the arms would rehome and let go of the vessel. Also, we lost video when it froze, so we couldn't just retract the instruments. Lots of people saying, oh crap, oh crap. 4. Brain surgery. Microscope video feed crashed. I was trying different video connections to get the overhead monitors back up, but every time I accidentally hit the scope with my hand, causing vibrations that were pretty magnified while working in the brain. He told me to never mind and to get the duck out. This was my first day, so it's okay. Many, many more. ORs are a scary place, but fun and exciting job for sure. Rewarding to save the day while a team of surgeons/nurses, PAs, all thanking you profusely. Story 13. I broke my wrist once, and the broken bone had to be surgically adjusted, so it would grow to be a nice and functioning one again. It appeared to be an easy and uncomplicated procedure, and 2 hours later, I woke up with a cast around my arm being told everything went fine. A couple of weeks later, I returned to the surgeon who performed the surgery to have the cast removed. As soon as he took it off, he had a confused look on his face. I could see him think crap, and he told me perhaps it didn't go exactly as planned. The 2 parts of the bone weren't placed in a straight line during surgery. So after a couple of weeks in a cast, my arm was now really funny looking and crooked. Arm had to be manually broken again and put in a bit more of a straight position. Few weeks and a wicked looking scar later, everything was okay again. Story 14. My mom had gone in for surgery. Because the hospital didn't have what they needed, they had to have an essential part for the surgery shipped to them. The day comes for the surgery, and my mom is prepped. The OR is prepped. The surgeon took the day off from his practice, and my mom is put under. The part they needed, a fluid I believe, arrived, and a nurse said, "We never ordered that," and sent the guy away. This is after my mom was under anesthesia. She said when she was being brought out of it, she could see the surgeon losing his crap on these nurses and all them crying from how bad he is flipping out on them. Rightfully so. Those nurses at that hospital suck. The surgery was moved elsewhere, and that was the last time he worked with that hospital. Story 15. When I was a medic, I worked in the ER one night, and this huge dude, maybe 350 dubs, came in from a car accident with the paramedics giving him CPR. We got to doing our job when it was decided that he would have to go to the OR as he eventually went asystole, flatlined. I was new and my knowledge was pretty limited at the time, but I believed they were going to massage this guy's heart. I was pretty relieved since we were all taking turns pumping this big-ass man's blood for him, and we were beat. Shortly after he left, I was talking to some of the medics' docs, and they says that it would be a great experience for me to watch it in the OR room. So I scrubbed up really quick and went in to watch in the back, and they were already about to start cutting this guy open. There was more blood than I've ever seen, and hopefully I will never see again. I don't remember anyone saying, "Oh crap," but I remember everyone getting really quiet. The staff stepping back as the blood flowed out of him. On the table, falling on the floor and crept until it got a couple feet away from me. I was like 6-8 feet away. Most of them were standing in the lake of blood when it stopped. The surgeon said that it looked like at least 3 liters of blood that came out of him. They hadn't seen that much blood come out at once either. It looked like some kind of Japanese horror scene afterwards, and I think I was in shock because I felt so weird and out of place afterwards, watching them so clean him back up. So there was little we could do to save this man's life. After that episode, I never was bothered by the sight of massive blood loss, since I don't think you could see any more than that come out of a person. Story 16. I was a junior doctor working in neurosurgery back in 2008 when one of the senior registrars, I suppose the equivalent is chief resident in the USA, told me his most unfortunate moment. In order to have a patient's head stabilized for surgery, he was using a frame that had a set of 3 spikes that held the head in place. Due to the angle he needed to approach from, this required the patient to be face down. Panicking and thinking that his career was now over, he then, rather bizarrely, started poking at the eyeball, trying to work out what was what, until the anesthetist told him to stop. They then called the ophthalmologist who came to tidy up what was now a completely ruined eye. After the surgery, terrified, he went to explain to the patient what had happened. Understandably fearing the worst, anger, distress, and tears received the response of, "That's okay, I was blind in that eye anyway. Luckiest git ever." Story 17. Yeah, this really happened to me when I was in training to be a cardiologist. I was in my 2nd or 3rd heart procedure catheterization when my senior doctor got sick, ripped of his surgical gown, and ran out of the room. The doctor had just yelled, "Oh no," and left. I had just positioned these catheters with wires into the sleeping patient's heart. They were just hanging out there, pulsating to his heartbeat. Apparently, the doctor had gotten food poisoning and made a run for the bathroom, never to return. So I've never made it to this point in the procedure before, and I'm just wondering where to take it from here. I haven't even been taught how to take them out safely. I'm looking at the vitals and monitors like, damn, what do I do now? Of course, they paged my senior cardiology fellow in training who is taking a nap and not returning any pages or calls. No other doctors around. Finally, thank God, my tech assistant, who has done these procedures since before I was born, gives me a nudge to flush the catheters, which I do, to prevent blood clots and death, essentially. And after a few minutes, properly removes the catheters and wires. They get treated like crap, but have saved all of the fellows in training and senior doctors many, many times in complicated situations with their knowledge. Story 18. I was rounding a few months back and a guy gets wheeled into ICU smelling terrible. I walked over, and the dude had maybe the most macerated legs I've ever seen. There were things moving on the bed, and the suction container was full of maggots. Turns out dude had been weaving on the road, and when police pulled him over and opened the doors, maggots fell onto the road. He got taken to the ear, arrested, taken up to ICU, and very rapidly debrided, then bilateral above knee removed. He actually made it out of the hospital, but I cannot imagine waking up one day and having no legs. I really wish I knew where he was driving, though. Story 19. Since I'm guessing there aren't too many surgeons on Reddit during the middle of a Monday, I'll throw in what I have. Surgical nurse here. I was an OR nurse for a very short time in between 2 jobs in hospital surgical units, taking care of post-op PTs. Right now I'm in a surgical step-down unit, which means really sick post-op PTs who aren't quite sick enough for the ICU, but could still start tanking any minute. Most of our oh crap moments are pretty boring, like, oh crap, they found more cancer. Oh crap, his oxygen percentage is going down. Oh crap, there's a mucus plug obstructing her airway. Things like that. In the OR, the worst I saw was some craphead optometrist who thought spending 5 minutes per patient was a good way to do cataract surgeries. Most surgeons spend about 15-25 minutes per surgery. At one point, he told me to keep the pre- and post-op eye drops uncapped because he didn't want to have to wait the literal 5 seconds it took me to unscrew the caps after each surgery. The patient's eyes looked all mangled and misshapen after the surgery, whereas every other cataract surgery I've ever seen, the PTs looked fine right afterwards. Not really an oh crap moment, but I told my boss after that day that I never wanted to work with that guy again. It was an accident waiting to happen. I heard one of his patients got an infection and lost their eye, but most of them were fine. Still, I wouldn't have let him watch my goldfish for a week-long vacation, let alone come at my eye. He was a douche nozzle. Story 20. Story from my vet. He was in a super rundown barn with a pregnant mare in trouble. She'd been getting up, lying down, and getting up again, but nothing was happening. Horse births are hell on earth, his words, because the foal doesn't turn until minutes before birth is supposed to happen. And if they're in the wrong position, it's nothing in there but rigid legs and sharp little hooves, and good luck getting that repositioned with 1,000 pounds of frightened horseflesh and pain on your arm. So there he is, at night, up to his elbow in this frightened mare. She's not really into what's going on and doesn't want to stand for it. He's not terribly fleet of foot in that position, so it's up to the owner at her head to keep her calm, and that person is doing the best she can. Keep in mind, this barn is in horrible shape. Really, just a dilapidated health hazard. Well, the mare decided she'd had enough and tried to walk through the owner. I'm guessing there was a stud chain involved, a metal chain that loops around the nose, jaw, over the gums, or however you want to attach it so that you have more persuasive power over the horse. The owner was shoved off balance and managed to grab a live, uncovered wire. Why there was one in a barn, I will never understand. But the result was that current flowed through her to the horse and into my vet. So now the poor guy is elbow deep in a terrified mare, while both of them and the owner are being electrocuted. He didn't tell us how he got out of that, but the mare was okay, and she delivered a live foal. They named the filly Electra. And that was when I first began to think maybe I didn't want to be a horse vet after all. Story 21. General surgeon, 5 years experience. Maybe not my biggest, but one of my first craps once I'd been set loose upon the world, was just realizing that I couldn't be in two places that I desperately needed to be at the same time. There's a certain vulnerability that happens when you're scrubbed in on a case in the oar. You're the captain of this particular ship right now, and you really should have your whole focus dedicated to it and only it. But sometimes you're in there in the middle of the night or on a weekend, and your partners are all gone, and there's just a skeleton crew running the hospital. Your goddamn pager keeps going off and your phone keeps ringing, and sometimes it's just Nurse X on the floor who thinks her patient really needs an order for Tylenol at 2 a.m., even though the patient is asleep. Sometimes the call is about how your patient is actively dying. Now, right now, heart attack, stroke, blood painting the walls of the room. Everyone trying to communicate this to you is in the process of either trying to stop the dyingness or is just freaking the duck out and begging you to come do something. You can't really just drop what you're doing and race upstairs. You have given an equally strong promise to both of these people that you will look after and protect them from harm. And you have to break that promise to one of them. You have to keep sailing that particular ship, otherwise both will go down. If you're lucky, there's an ICU team that can swoop in and help, or residents experienced enough to handle things, or a backup partner who can ride to your rescue and caring about having to help out Junior all night later. Other times, there's literally nothing you can do except tell the nurse, do what you can. I'll be up as soon as I'm done with the operation. Story 22. Probably not the story you want, but still. My father's a surgeon. Once upon a time, right before he got married, he saved the life of a jeweler. The jeweler talked about these elaborate golden wedding bands he could make. So when my mom and him were about to get married, they didn't have a lot of money. They saved up every penny so that my dad could request these huge, gaudy 18-karat wedding bands. Seriously, the ugliest things I've ever seen in my life. The jeweler made them and gave them a huge discount, allowing them to keep a good majority of the money they had saved. My dad loved them. Fast forward 40 years, the jeweler is definitely deceased at this point. The guy was like 60. My dad was coming out of the oar. He typically would tie his wedding ring around the waist ties of his scrubs. Well, he goes to the bathroom, does his business, goes to flush. As he's flushing, he's bent over and the ring springs loose and falls down the toilet. He frantically calls his secretary, who calls the plumber, who informs him that the ring is gone. 40 years he had this ring. The light at the end of the tunnel was my mom gave her ring to my dad and had it expanded for him. Meanwhile, she got a fancy modern platinum ring that's worth more than my college tuition.